Representative Grossell.
Thank you, Mr. Chair and representatives. I'm Representative Matt Grossell for District 2A, and I'd like to introduce Elizabeth Engum, RN.
Just move
Oh,
the bill in.
I move to have my bill laid over for inclusion for omnibus.
Okay, thank you.
Okay, sorry about that.
That's okay, go ahead.
I'd like to introduce the two people to my left here, Elizabeth Engum, who is an RN, and Peggy Hoft, an RN retired, and they'll be giving testimony today. I want to introduce HF 1481, enhanced criminal penalties for assaulting firefighters or medical personnel. This bill amends section 6092231, which criminalizes assaults on firefighters and emergency medical personnel. This bill makes the following changes to the statute. It expands the class of protected persons to include all medical providers who work in a hospital. The current law applies only to medical providers who work in a hospital emergency room. It creates a gross misdemeanor penalty for a physical assault on a firefighter or a medical provider who works in a hospital where the assault does not cause demonstrable bodily harm. The current law applies only when there is demonstrable bodily harm. And 3, it creates a felony offense punishable by up to 3 years in prison and a fine of $6,000 for intentionally throwing or transferring bodily fluids or feces onto a firefighter or medical provider who works in a hospital. That increases the maximum period of imprisonment for assaulting a firefighter or a medical provider who works in a hospital when the assault causes demonstrable bodily harm from 2 years to 3 years, and in cases the maximum fine from $4,000 to $6,000. I just want to give you a little bit of information here as well. Healthcare workers are at high risk for workplace violence with very little retribution for those inflicting the violence. The highest number of assaults in the workplace in the U.S. are towards healthcare workers. 24,000 workplace assaults occur each year, with 75% of those being in the healthcare workplace, and that's from Phillips 2016. It's Phillips JP Workplace Violence Against Healthcare Workers, the New England Journal of Medicine. Second thing is, according to the American Nurses Association 2016, healthcare workers whom leave their jobs as a result of workplace violence can contribute to their shortages of nurses. And that's from the American Nurses Association Model State Bill, Violence Prevention in Healthcare Facilities. As one who has worked in law enforcement and emergency services, and one who has had to bring violent people to the ER or to the hospital for treatment, it was oftentimes, because I worked in a small county, I was the only one on duty, and I would get called away, but I would have to leave that individual there. And knowing full well that, that I just had to fight with this person to take him into custody and to subdue them and then to take them, arrest them. And now I've got to leave them with medical personnel who are not trained the way I am, who are not equipped to handle those types of persons. So it was always something that in the back of my mind I didn't like to do, but because I got called away to another call, it's what I had to do. And then Ms. Engum here approached me after I got elected and asked if I would do some research on seeing if there was something we could do to give more protection to hospital personnel and firefighters. So I will now I guess I will turn it over to my two speakers here.
Well, okay, ma'am, introduce yourself and begin.
Hold it.
Mr. Chairperson and representatives, my name is Liz Engum. I am an RN at Sanford Bemidji Medical Center and work in the intensive care unit. In 2006, I took an oath, the same oath that all nurses take, to devote themselves to the welfare of those committed to their care. Every day, I and fellow nurses are placed in situations that may become violent. An example of this situation is that of which a patient that we were taking care of on the unit. She was there with an overdose in alcohol. She became aggressive and verbalized the intent to cause harm to a coworker. She proceeded to grab the coworker's arm, pull her arm, and tear her rotator cuff. The result of this action was multiple surgeries for the coworker, a great deal of pain, a year away from direct patient care, and the permanent loss of freedom of movement of her affected arm. I myself have been involved in or witnessed patients spitting on, hitting, scratching, or kicking nurses. These actions were committed by patients who had verbalized or appeared to have the intent to cause harm. In states such as Florida, acts of violence such as this hold the same penalties as those if they were committed against a law enforcement officer. I feel that if there was increased penalties and public awareness, it would force patients to reconsider their behaviors. This in turn would cause a safer work environment for nurses throughout the state of Minnesota. Thank you.
Ma'am, introduce yourself, name and title, begin, please.
Good morning. Thank you, Mr. Chair. My name is Peggy Haft. I'm an RN retired from Abbott Northwestern Hospital. While working one evening in the intensive care unit, I walked into a patient's room when I noticed he was getting out of bed despite being hooked up to various IV catheters. I remember saying, "No, no, go back," but before I could reach his bedside, he lunged at me and had me by the neck. He pushed me across the room. When I looked up, I saw his fist ready to strike me. I remember thinking to myself, I would rather get hit in the back of the head than in the face, so I turned away. A sound in the hallway distracted him, and soon several other staff members were in the patient's room. In my 30-year nursing career in the ICU, I experienced violence toward me numerous times, none of which should be considered part of my job. But this time was different. No patient had ever so deliberately and violently assaulted me. As I was being treated for my injuries in the emergency room, the nurses caring for me asked if I wanted to contact the police. I did, and I spoke with the Minneapolis police officer that evening in the emergency department. Several days later, after filing that report, I contacted the Minneapolis police. I was told that because the assault against me occurred in the intensive care unit as opposed to the emergency department, the penalty for the crime was lower. The officer told me I could press charges, but it would be difficult to obtain a judgment. I decided there wasn't really much point in pursuing the case. At the time, and now too, it doesn't make sense to me that the same crime committed in an outpatient setting, such as the emergency department, would carry greater consequences than when committed in the intensive care unit. I'd like to finish with some information and a quote from Mary Turner, who is the president of MNA, the Minnesota Nurses Association. Healthcare workers are assaulted every day. They are hit, punched, kicked, pinched, and verbally assaulted so often that some just accept it as part of the job. Nurses of the Minnesota Nurses Association feel strongly that violence is no part of that job. We hope this effort by Representative Matt Grossell will create a safe environment for patients to heal and effectively address the rare instances when an aggressive person should be charged with assault. We trust Representative Grossell knows what it's like as a police officer, and he's related that, to bring a patient to the emergency room in handcuffs and then leave them for nurses and others to treat. I thank him for standing up to take on this issue. Thank you, Mr. Chair, for allowing me to tell my story, one that's all too common.
Okay, Representative
Mr. Chair?
Considine and Representative Ward. Yeah,
have one more person to testify, if I could, from the firefighters.
Yeah. Go ahead, sir, with your name and title and begin.
Thank you, Mr. Chairman. My name is Kirk Peterson. I'm with the firm of Rice, Michaels, and Walther. We represent the Minnesota Professional Firefighters. It's a group of about 1,600 full-time professional firefighters that represent about 43 communities throughout the state. We also support this bill. Appreciate the representative bringing it forward. The nurses did a really good job of telling the examples of what we have to go through. In many communities, the firefighters are the first responders on medical calls. Often the fire departments get there before the ambulances, and we end up transporting or assisting with transporting people back to emergency rooms and end up staying with them in the hospitals. And we go through a lot of the same things that the nurses go through. So I don't have a lot to add other than that unless anybody has any questions, but wanted you to know that we do support this bill.
Okay, thank you, sir. Now, questions, Representative Considine, Ward, and Pinto.
I don't have a question, Mr. Chair. Well, actually, I do at the end. Happy to be a co-author on here. I think we should be extending the same protections that we have extended to corrections officers and the police. Actually, my question, though, is, isn't this Representative Grossell's first bill in front of this committee? And didn't he forget a tradition?
Representative Grossell.
Yeah, where's our cookie?
Yeah.
Actually, it's the second bill.
First one was yesterday.
Oh, first one
Who
was.
does the cookies?
Well, we didn't get any cookies then either.
I'll make it up to you.
All right.
We'll hold you to that.
Representative Ward.
Thank you, Mr. Chair. I too support the idea of anything that we can do to keep people safer. I do question how we can do that, though, and is punishment going to be the right thing when we're talking about people who are out of control of themselves? They're not thinking rationally anyway, and I don't think they're going to be swayed by punishment. My son is an ER doctor, and I have a daughter-in-law who's an ER nurse. And before that, Chris was a paramedic, so he's done these kinds of things and been in those positions. And I have a great deal of sympathy and concern for all of the medical personnel and the firefighters. You know, my instinct says we've got to do something about the violence in our society so that people aren't put in these positions in the first place. But I particularly wonder if there isn't something else that we could do to ensure safety in those places so that you don't have to leave, or that, you know, is there some way that we can provide backup to you so you don't have to leave people in vulnerable situations?
Representative Grossell, short answer if you could. We've got 2 more questions and 2 more bills. Go ahead.
Okay. Thank you, Representative. And I trust the professionalism of the nurses, the doctors, the paramedics, the firefighters, and law enforcement. And as far as making that discretionary call as to what occurred, you know, it's not going to be a free-for-all as far as charging people that are not in the right state of mind, that are not in control of their mental functions at that time. And then again, I trust our county attorneys and our judges to look at those situations as well. So it's a matter of taking care of the people who are trying to take care of us. That's what I want to do with this. But again, I trust their judgment and their discretion as to what is an intentional and violent attack against them.
Okay, Representative Pinto.
Thank you, Mr. Chair, and thank you to the testifiers, Representative Grossell. I support the bill. I'm a co-author on it. But I was thinking about just one issue in it's 1.13 and 1.14 about removing the reference to emergency department. What I'm thinking is that there's a lot of physicians and nurses that are working in other medical settings, and I'm just trying to think, and again, I haven't landed on this, but I'm just thinking that once we take away the limitation of an emergency department, now hospitals providing care in all sorts of other settings that look a lot like other medical clinics, And now suddenly are we kind of saying that in any medical setting, which we're not here, but I'm just trying to understand what the distinction might be. I'm wondering if either you or the testifiers can help me think that through, because I feel like an emergency department's one thing, that makes sense. It looks a lot like a secure treatment facility or correctional employee, some of the other things we have under 609.2231. But once we start extending to other parts of the hospital, people coming in for other kinds of care, then it starts looking like those other clinics. And I'm trying to think of what the distinction is.
And there's,
Representative Grossell.
thank you, Mr. Chair and Representative. There have been incidents that have been, for example, in the ICU, there's someone who has been there and is being treated and then attacks someone. So it's a matter of, to cover those people while they're in their duties. There have been incidents where people have been assaulted in waiting room areas, or when they're coming in. So it's to help cover the personnel that we have in vulnerable situations. They don't have somebody to watch their back all the time. Firefighters don't have somebody to watch their backs. Nurses don't have someone to watch their backs. So it's a matter of covering as many people as we can to give them the blanket so that they can work and they can take care of the people. And if something should happen, that there is some recourse for them.
And, Mr. Chair,
Representative Biddle.
I guess I'm just trying to, I guess I'm thinking that though the same sort of things are true in waiting rooms in other medical facilities. Somebody might have, some kind of outpatient treatment at a hospital, might end up going to a smaller clinic, but it's not a hospital. I'm just trying to understand the distinction there of why we wouldn't be then covering all medical personnel, which I'm not advocating for. And then I start getting worried that now it's just looking like all sorts of professions could get covered. I'm just trying to understand where to draw the line. We may not solve this here, but I guess this is just something that I'm still kind of struggling with.
It'd be something that we could work on.
All right, thank you. Thank you, Mr. Chair.
Representative Dean.
Thank you, Mr. Chair, and I think you might have already, spoke to the question I was going to raise around county attorneys and judges taking into consideration those individuals who might be in a hospital, say on a psych unit or a locked unit or something like that, which I think the care providers in that unit understand that they might be a little bit greater risk, but at the same time, a person's mental state at the time would have to, I'm assuming, play into how a county attorney or a judge might consider these types of enhancements to penalties.
Okay. Any questions from members? Any public testimony? Oh, question. Representative Newberger.
Thank you, Mr. Chair. And in the interest of time, I'll be brief. Representative Grossell, thank you for bringing this forward on behalf of all of the folks in the emergency medical community and for all of the folks that have co-authored this. I have had partners who've had their teeth knocked out. I have had partners female partners and male partners who have been assaulted in the back of ambulances with patients. They had no clue. They never saw it coming. In one instance, they stopped the ambulance because the assault was in progress. The patient, who is now committing this assault, jumped out the back door and ran off down the freeway. Thankfully, the assault stopped at that time. On the flip side of that, I had another partner who had the exact same thing happen to, and when they stopped the ambulance, the assailant jumped out of the back of the ambulance, ran away, saw that the police weren't there, turned around, came back, and continued the assault. Myself, I've had patients look me right in the eye and say, I have tuberculosis, and spit in my face. And of all of these cases, I can tell you that nothing happened. So thank you on behalf of all of these medical providers, whether they're in a hospital or whether they're in an ambulance or they're a firefighter. Thank you for doing that. And just briefly to Representative Pinto, to your comments, I think what we're looking for is perfect, and perfect doesn't exist. This is really good, and I'm okay with really good. And I think that if you look into the number of occurrences of these assaults that happen, the overwhelming majority of them are either on the street or in a hospital. I don't think that the numbers pan out in the clinics. Would I like this to expand to clinics? Sure, I would. But right now, that's in the scope of what we're trying to do here. We're going to settle for really good. I don't know if we can get to perfect, but I'll take really good. Thank you, Mr. Chair.
Okay, a representative from NAMI here, go ahead.
Yes, thank you, Mr. Chairman, members. Sue Abderholden from NAMI, Minnesota. I just want to raise a concern, and that is, again, for people who are in a psychiatric unit, also someone who has serious dementia, someone with a serious and more profound autism who might be actually tactically defensive, so if someone touches them, they might, just automatically do that. And the word intentional is only on line 1.19 and not 1.18, and the standard for being, being not guilty by reason of mental illness is actually really high, which is higher than, really trying to assess whether someone really was intentionally. I can understand when someone's threatening, to do that, and they do that. But I just want us to be cautious. We don't want to keep putting more people with mental illness, in jails and in prison when they're in a crisis state when they get to the hospital. Thank you.
Okay, members. Anyone else from the public? Just a real quick one here. We always worry about these, whether the deterrents are actually working or not, but NAMI, I don't think, was too excited about a bill I had where we were charging mentally ill and dangerous in St. Peter. But we were having a problem with continued assaults in St. Peter, as Representative Considine knows. But we upped the penalty because the county attorney said it was hardly worth charging anybody go up against a Rule 20 hearing for such a low offense. So we upped the penalty. The county attorney started charging. And I called, I had a couple calls from people out at the St. Peter Hospital said that it seemed to be working as a deterrent and the assaults have come down. So I believe that deterrents can work sometime, but we don't want to naturally throw everybody in jail. But the county attorneys can always be a filter and help make that decision of what was intentional and what was an abhorrent act. Any other questions from members or public testimony? Seeing none. Representative... Let's see. Oh, Representative Grossell, you can move your own bill to be laid over.
I move it, so.
Okay, Representative Grossell's bill, House File 1481, will be laid over for possible inclusion. Thank you, Representative Grossell.
Thank you.